Do I really need a Medicare insurance agent? Having been licensed for over 20 years as an insurance agent, you'll probably assume that my answer would be yes, you need an agent. Not all agents are created equally, and unfortunately, there are more bad apples in this industry than there are good. In 2021, CMS received over 41,000 complaints about Medicare brokers, highlighting that many insurance brokers may prioritize quick commissions over clients' needs. Beneficiaries often feel overwhelmed when new to Medicare and can be easily pushed into buying a Medicare Advantage plan by a bad broker instead of being shown all of their options. So with that tells you that there's a staggering number of Medicare agents in the field, and there's a very high number of complaints that CMS receives each and every year. Our office personally receives a lot of calls from frustrated clients of other agents. They can't get a hold of their agent. They don't know where their agent is. The agent won't call them back. The agent put them in a plan that does not have all their doctors in the network. The agent put them in a plan that does not have all of their pharmacies covered. So let's take a look at some of these tips that I put together to help you decide whether the individual that you want to work with is right or not. Beware of broker bias. Beware of brokers who attempt to push you into enrolling in a Medicare Advantage plan, especially if they don't mention any other options. The other option is going to be a Medicare supplement plan. It is startling how many agents never bring up Medicare supplements. They only bring up Medicare Advantage, and that is because the commissions pay more. From the surface, a Medicare Advantage plan looks more appealing to a Medicare beneficiary because they usually have no monthly premium and additional free extra benefits. So it's very common that beneficiaries can get caught up in that no premium plan and quickly lose sight of some of the core basics of a Medicare Advantage plan, like referrals. Are my doctors in the network? Are my prescriptions covered? How do prior authorizations work? Generally, agents won't take the time to do that. They are very quick to rush you into a Medicare Advantage plan. The highest amount of activity in the Medicare world comes every year during the annual election period. And what a study found was 85% of Medicare ads during the open enrollment period in 2023 were for Medicare Advantage plans. What was advertised was low cost, extra or free benefits, or getting money back for your Part B. What you typically don't see advertised is customer reviews, coverage restrictions, high out-of-pocket limits, limited networks, referrals, and prior authorizations. So it's very evident that the Medicare industry as a whole and all of the insurance companies are predominantly marketing Medicare Advantage. You usually don't see much advertisement for Medicare Supplement, and that doesn't make Medicare Supplement bad. It just means that the industry prefers Medicare Advantage because the company and the agent makes more money than Medicare Supplement plans pay. So here's a few things that you can also look for. Bad brokers may do these things. They prioritize their commission pay. They rush you into a plan. And here's the one that I hear the most at my office. They disappear once you've bought a plan. And they usually withhold important information, maybe because they think that will slow the sale down, or maybe because they're inexperienced and they just don't know what important information you need to receive to make a decision. Our office gets a lot of calls from people that say, my agent enrolled me in this plan last year. It's a new year and I need to make changes or decide if I need to change plans, and my agent won't call me back. A good agent should enroll you in a plan based on fact finding, but then they should always be available to you every year to do policy reviews or check in to see if you have questions, or if you have questions, you can always get in touch with a good agent to help answer those questions. Let's look at how to find the right broker or agent. Experience is a big one. Opt for a broker or agent with at least 5 years of experience. At least 5 years. Most agents get into this business and it pays commission per policy. The longer an agent is in this business, the more relaxed and more professional and more organized they become as it being a career, a long-term play that services the client, and it's not a fly-by-night desperate agent trying to make a sale. Another thing to look for is credentials. Can you find the agent's bio online to find their qualifications? Do they have a Gmail or a generic email address? Most established agents or agencies are going to have a well-established brand or name, and they're not going to be using a Gmail or Yahoo anymore. They're going to be bob@insuranceagency.com as an example. That just shows one extra step they took to focus on professionalism and care and how they are viewed by the public. What company do they work for? Do they have client reviews that you can look over? Have people used them before? Is there any way you can track down information about them on Google or on YouTube? Where are they? Is a big question. If you can't find someone on YouTube or Google with just doing some basic searches, that's a red flag to me that they should not be that hard to find if they are the professionals in this industry. Another thing to look at is clients. Ask how many clients the broker serves annually. A reputable broker is going to have a large client base. It's a career. It's a profession that they're in. They will be around for a long time, which means that if they've been around a long time, that means that their client base builds because the clients are happy and stay with them, and more people are coming to them by either advertising and referrals. Therefore, success can be based on a larger client base. And lastly, look again for reviews. Seek feedback from previous clients. Positive reviews will support the broker's reputation. If you can't find these, that is another red flag to me. An agent needs to make money to pay their bills. So they tend to do desperate things and become pushy and to get people enrolled so they make money. At Policy Guide, we take a totally different approach. First, we consider your Medicare coverage start date, which determines your eligibility for different enrollment periods. Our process is going to be very in-depth. We then determine your benefit preferences, what type of plan you like, what type of plan you've been used to, your lifestyle habits. Do you travel? What's your budget? What's your health like? Do you have chronic health conditions that require a more rich, comprehensive plan? Do you mind staying within a network? Do you need dental insurance? So we try to put together a strategy of not just, hey, we have a free Medicare Advantage plan. We try to look at what are you used to in the past? What are you comfortable with? If it's copays or deductibles, there's a lot of things that go into the client needs analysis to determine which plan is best for you, and that is not based on which plan is best for us as the agent. Next, we'll review your current healthcare providers, medications to ensure your plan covers everything you need. If there are providers or prescriptions that a plan won't cover, we are going to tell you that up front. We will not hide that. We will disclose. We come across people all the time that have 5 or 6 doctors, and we say, we think this plan is a really good fit. 4 out of the 5 doctors you use are in the network. This 5th one is not in the network. Does that matter to you? Is it someone you need to maintain, or is it a doctor you haven't seen in a long time? And lastly, we'll explain the differences between original Medicare, Medicare Advantage, and Medicare supplements to help you decide. That is a big value add for an agent to take the time to explain the 3 different avenues that you have and not just focused on one, like many are with the Medicare Advantage plans. I hope this video was helpful. I hope it gives you some insights. If you'd like to work with us, we'd be happy to help. You can comment below, give us a call, and then we would go through a needs analysis and let you know which plans are available in your county that may be the most suitable. If you do select a plan, you have an ongoing service agent with us. So if you have questions in a month, 6 months, or 6 years from now, you can always call us about any questions or concerns or plan changes, and we will help determine if you're still in the best situation. Thanks for watching.